Hey, welcome back to another installment of Going Mental. In my previous last two, I really focused on, I guess, a school-based approach for kids and all that kind of stuff. And when I really think about, why I started even doing all this stuff over the years, I've been, say, fortunate enough, but maybe also unfortunate enough to see statistics when I work in healthcare. I'd see statistics as a part of the executive team around the type of um, care and activities that our nurses and our outreach centres and stuff like that were doing. And a lot of it was quite alarming around, really young children, 11, 12 years old, you know, being on suicide watch or being on antidepressants and all kinds of things. And then with my police background, you'd also see young kids, constantly in and out of foster care, being abused by their parents, all a lot of number of horrible things. And I've spoken about ACEs or adverse childhood experiences before, and they're good predictors of potentially children having more problems down the track because they have all this stuff happen to them at an early age. And obviously, a big part of my motivation when I wrote the book behind me there, Lighting the Blue Flame, was very much about initially it was trying to actually do a school program to help schools deal with this in a much better way. And with my HR background, I do a lot of work with teams, as in employees, mostly adults, obviously, who we try to build a better team, have people interact better with each other, build trust, and all the things that we know add to that team being a high performing team. If we use the same similar approach to children, they might not be working necessarily together for a common goal. They might just be getting a good education, but understanding the principles of good teamwork, good social skills, good dialogue, good skills to be resilient as a person, but also be a good friend, colleague, just a good citizen in general. So I kind of used a lot of those things to really try and excuse me, improve what we could do at a school level, and hopefully try and avoid you know young people taking their own lives or young people suffering from mental health issues that can be avoided. It could be a lot more positive life experiences for them. So ultimately it's about really trying to see how what I do and how I can help with teams and develop other teams to do this work. The important part of that for me was about being able to have other people replicate those things, put it into a program. So in my book, I specifically focus on, I call it my full mental jacket program, where really there's a number of steps to help with developing a person, an individual, so the stuff the individuals can do themselves. But then there's also the social aspect of, we're not individuals, we work with people, we design that way. Our blue brain or our prefrontal cortex is very much a social part of the brain. It's the part of the brain that also allows us to problem solve, think outside the square, come up with solutions, all that kind of stuff. So essentially, we want to be able to make it replicatable, as teachers running it, trying to use the maximized volume of people that can kind of do it, whether we do it by courses or do it through videos like this where people hear it, they pass it on, especially if they get something out of it and they can see how they can apply it in the workplace, apply it at schools. Excuse me. And so, we really want to, I guess, enhance that. And that was the reason I started doing these videos. I do obviously lots of these. I've been a speaker in a number of different platforms and all kinds of stuff. And so, for me, it's a real big motivation to try and get the word out there, to kind of get people and making things practical for people at that level. So little things like, having a conversation with kids, getting them all in the room at the end of the day or towards the end of the day and discussing things that have been a problem during the day at school. And if somebody in that room has been that person that's been the problem or the reason for that problem, then we can talk about it. So we're developing their skills. It's also, trying to create, as a teacher, you want to create safety for them to have that conversation. It's like, just because this person says something about me, I don't then get angry and really want to lash out. And, the natural instinct is to get defensive. So we're kind of working on two spaces as educators, or when I run stuff with two individuals who are adults who might have problems with themselves, with each other. And effectively, we're trying to create a safe space to have that conversation. We're trying to create safety and say, hey, so you're getting defensive now, but why are you getting defensive? Let's analyze that. Let's actually use our blue brain to analyze why we're getting defensive and keeping ourselves out of red brain. So there's kind of a skill set that we want to slowly develop, especially in kids. Obviously, adults, they probably understand a little bit more, but at the same time, they also have sometimes very entrenched patterns of thinking where they can get aggressive really quick. Everyone knows that person that they work with who's highly aggressive, and they kind of go, oh, don't go talk to Clint now because he's always grumpy on a, when his team loses on a weekend, or those kinds of things. So with younger kids, that's not kind of a fully grown pattern. That's why I think we can interrupt those adverse childhood experiences and really focus on how we can move them forward past those, so those things don't become bigger issues. They don't ruminate over stuff that happened 5 years ago. They can kind of go, okay, it happened. I can do this, this, and this to move forward. I can have a conversation with someone that's treating me badly. I can choose to leave a poor relationship. I don't feel like, because of my self-worth or the way I look at myself, is going to affect me having to stay in a relationship I don't want, or me going after things I actually don't want, which is actually detrimental to me as a person, for my own health, my own safety, all those kinds of things. So it's really important that we're developing those skill sets and really understanding how we can, it's not that hard really. It's just about simple, good principles of being a good person, right? Kids that don't have those role models are behind the eight ball. Doesn't mean that we can't help them accelerate that curve back up. If they've had poor role models, yes, police will get involved to do, if it's obviously illegal stuff, but at the same time, how we can develop them, how we can use our time at schools, how we can enhance that as a team, but also taking really, really proactive steps to set that particular class or group up for that success, where we can kind of discuss, say, hey, we all have different talents, we all have different speeds which we learn. Some kids have had no experience. I have parents that read to them every night and teach them stuff and give them lots of stimulus. So we can kind of try and work on how we do that better as a team, how we help the kids who are a little bit disadvantaged to come up a little bit. The ones that aren't as disadvantaged, we can use them as sort of smaller role models, but also enhancing that approach of wanting to be kind, wanting to be helpful, wanting to, not create that bigger divide where now you're hanging shit on this other kid because he hasn't got the right shoes or the right brands and that sort of stuff. So we want to work on those two fronts. That it's kind of like, you can, to avoid bullying, you can either help the kid be resilient or help the bully not bully others, right? So there's two parts to that. So, ultimately you want to do both. If you're really resilient and there's less kids bullying everybody at school, you're going to have a much better result than if you've got a heap of bullies and the kids aren't resilient, and you're going to have a big problem. So really breaking it down into simple terms is part of what that book's all about. It's also part of why I do these videos, because I do see that there's a massive opportunity, especially in Australia. I can't speak for other countries so much, but a lot of my research shows it's similar in a lot of other countries. So we can do a lot more. We can be quite proactive. I think we just need to get the right people talking about it, having the right people in the room to kind of, nut out a good plan. As I said in one of my previous installments, I've been in front of the Commissioner of Queensland of Mental Health, and while his title's great, it's like a toothless tiger. They can't really do enough. They don't really have any impact. It's all well and good to say, oh, we're spending so much money on having a mental health commission or a part of a team, but if they're not effective, why are we bothering? Let's start to be more effective. Let's start knocking on doors and saying, hey, you need to listen to these people. These are people that actually want to do better and have proactive ways of doing it. Let's start doing that. Hope you got something out of that. Cheers.